About 7 years ago, I was working in the Department of Health, working in non-communicable diseases. We had a report that was saying effectively that we were going to fail in most of our targets on non-communicable diseases because effectively we weren't being able to get behaviour change within the communities that we were working in. And I'll give you an example that I was working on a teenage pregnancy programme, sat around a table with 12, 13 middle-class white males, all civil servants, and trying to develop a programme to combat teenage pregnancy. We just didn't have an understanding or a clue of how those people lived, what their attitudes and behaviours were. And our whole idea was to develop a programme that was around increasing the numbers of condoms available. Of course, we went to see these people, did some research. We found out that actually these people did want to get pregnant. They wanted to have children. So our total campaign or programme would have completely missed the point. So we started looking at an idea about social marketing that had grown in importance and acceptance in the United States, but also abroad in India, and had been used. And social marketing, at its heart, at its most important, is really understanding the people that you're trying to help, researching them, trying to understand why they behave the way they do, and then developing a program around them. So a lot of people think of social marketing as social media, but it's not. It's a planning process that really gets to understand the people that we're trying to help and engage with, and then building programs around them. It's a program that's based in the United States, and it was a program around trying to reduce the number of accidents in the Latino community. And in one of the cities, it was in Texas, Dallas, Texas, there was a big Latino community, usually mothers driving around in kind of quite old cars with their children, not in safety harnesses or safety seats. So the traditional approach, and the approach that they took, first of all, was to say, well, let's just translate some of our existing pamphlets into Spanish. And of course, that will make all the difference. So they tried that, and nothing happened. Nobody actually utilised the car seats. And then they said, well, why don't we try and giving away or try and subsidising? And of course, nobody did anything, nothing changed. And then a social marketer came and said, well, why don't you talk to these women and see why they're doing the things, why they don't harness their children? So they went and spoke to them, and the women said, well, effectively, we believe that God will decide when they're going to take my child, and my child is safest in my arms. And so what they did was to try and build a program around those beliefs. They got the priest to bless the car seats in a kind of, I suppose, almost a church service. And the numbers of people using car seats in that community went up by about 40–50%. And there was a dramatic reduction in accidents and children being killed. So that's a very typical example, but it's a very good example because often in public health, we tend to be very good at messages and informing people. It's like if I ask you, do you eat 5 a day, 5 fruit and vegetables a day, or do you take exercise 3 times a week? And even if you ask me as a health professional, I'd say, well, it's pretty difficult. But some of the people that we're trying to help in disadvantaged communities, they can't even do that. So informing and education is not enough. You've got to really understand the lives, their people's lives. So I'll give you an example of a programme in the UK where we wanted children to eat 5 fruit and veg. So the traditional approach was to inform and say to mothers, you really have to provide your children with 5 fruit and veg a day. But of course, in the estates that they lived, they couldn't actually buy fresh fruit. And because they had kids, they didn't have cars, so they couldn't go to the supermarket. So that was the reason why. And so just understanding that meant that we was able to develop a fresh fruit and vegetable stall at the school and providing fresh fruit and vegetables. And the other thing that we found out was that children don't like eating vegetables or fresh fruit because they think, well, actually, I'm not very keen on that. So we packaged the fruit and vegetables in a different way. in individual portion sizes, and we made it attractive to them. We also made it a game, so in the classroom, if they all bought or had fresh fruit on a daily basis, then they were able, the class won a prize at the end of the month. So it's really just understanding and then developing programs around them, and sometimes communication can be enough, but it's hardly ever is. You actually have to design something for these people. And as I say, it's all very well saying eat more fresh fruit and vegetables, but if women can't actually buy fresh fruit and vegetables, or they don't have the income to do that, or sometimes they don't even have the knowledge to be able to cook vegetables in a way, so they just go to the frozen food counter or buy from the kind of fast food places, because they just don't know. So as I say, social marketing is really about understanding and then really developing programs around them, and sometimes altering a little bit about the whole design of the way that those people live their lives. Well, I'll give you an example of a really fantastic tobacco campaign which was done in the United States, and it was young people trying to stop young people from smoking. Now, if you've got young adults, if you have children, I've got a teenager, but if you say to him, you know, smoking will kill you, or smoking will make you ill in the later part of your life, they're not interested. You know, they're not even really interested in what's happening this afternoon. And in fact, there's a lot of research that says that young people, if you say to them, smoking will kill you, it's part of the rebellion of young people's lives. So the Truth campaign in the United States said, well, okay, you know, you think you're rebelling, but in fact, all you're doing is fitting in with the tobacco companies because they're targeting you and they're manipulating you. So they reversed it. So the young people started having campaigns and rebelling against the tobacco companies. And in I think it was Florida, and I can give you some examples of this and send you examples, they reduced smoking in young people by around 20–30%. And that has been consistent as well, and saved, I think it's about £4.5 billion in medical care costs. So, you know, social marketing can really turn people's attitudes. And the one thing I would say is that social marketing obviously uses the same types of tools as commercial marketers. So what it means is that we can turn those tools against them. So we can reverse market against them. So in alcohol, at the moment, you know, if you look at all the adverts about alcohol, it makes alcohol look really attractive. But you can actually reverse it and showing people at the end of nights with their ripped shirts or being punched or a real mess at the end of the night because they've drunk so much. So it's reversing some of the kind of the ideas, the marketing that's done in the commercial world. And we use the same techniques. We use deep insight, segmentation. We also use exchange theory as well. All of the things that they're very good at. So I know somebody actually said that we use the devil's own tools. So the tools that are used to make us fat, alcoholic, smoke a lot can be used in reverse. And that's what social marketing's about.